Hi there, Dr. Andrea Shanowski from Health and Horsepower, and today I'm really excited because I want to talk a little bit more about colic. I know that many new moms and new parents deal with this a lot, and they have a lot of different concerns. Number one, why is my baby crying? And also, what can I do about it? Because a lot of times there are so many mixed messages in the media, in the research as to what pathways we need to look into to find out what is going on for our child. So I want to talk first about what is actually the clinical definition of what colic is. So colic is defined as when baby is crying for more than 3 hours per day, for more than 3 days a week, for more than 3 weeks at a time. So basically it's the 3-3-3 rule. So if they're crying 3 hours, at least 3 days a week, and for 3 weeks, that is the actual definition of colic. Now, when it comes to colic, there are a lot of different symptoms we can see. So we can see excessive crying, we can see high-pitched screaming from baby as well. We can also see some complaints of gas pain or stomach pain or even vomiting from kiddos. We also can see issues where they are arching their back when they're crying or lifting themselves up, like if they're laying flat on a space. We can also see where they pull their knees up to their chest when they're crying. We can see where they clench their fists. And we can also see more issues typically in the afternoon or evening. I know a lot of people like to call this the witching hour. But a lot of times when we have colic symptoms, we need to really figure out what is going on. Now, a lot of times, it used to be that when colic happened, it would just kind of be blown off as, well, you just have a colicky baby, deal with it. But a lot of the research now is actually showing that there are some associations and a couple different things, 3 in particular, that we're going to talk about today, as well as what to do about those. So before we get into that, I wanted to just give you a little kind of breakdown of the birth process, because I think it's really important to understand that when it comes to birth, it's not always the easiest thing, and that can we can have injuries that happen during the birth process that can lead to dysfunction and discomfort. And that's actually one of the first things that I recommend every child get checked. After the birth, so if we think about it, when we have a natural vaginal birth, we have about 95 pounds of pressure on the top of baby's head, and their muscles in their neck are not strong enough to support their head up. So a lot of times that pressure goes directly from their spine down into their spinal column, and we can actually have, especially if they're getting stuck or if we have a very forceful or very long labor, sometimes even where they get stuck in the birth canal, we can actually have where they're getting pressure on different areas of their spine, or if they're being assisted out of the birth canal, we can also have excessive pressures that are put either on the neck or the shoulder, or sometimes even on the lower back. And if we have a C-section, a lot of times if baby has already descended into the pelvis, when they are being removed during a C-section, they may actually be pulled out, and they can also have some damage as they're being pulled out of the birth column. So just keep in mind the birth process is not exactly the easiest for mom or baby, because like I said, there's a minimum of 95 pounds of pressure on the top of baby's head coming out of that birth canal. So sometimes those bones can shift, the muscles and ligaments can actually be damaged or pulled through the birth process itself, and that can cause a lot of issues. Then of course, we have feeding happening and learning how to be a new mom and learning how to hold baby and learning how sleep schedules should be, or how your baby sleeps, or when they sleep, or if they're having difficulty sleeping. There may be a number of different concerns with that. We can also have feeding issues where positioning during feeding, or sometimes even we may have reactions to formula or even reactions to breast milk sometimes, and mom's diet as well. So the 3 things typically that are most commonly seen when it comes to colic are maladies within the digestive system. So some research has actually shown that gallbladder can actually cause colic symptoms as well. They actually did a study on babies after they were born as well as after eating. So before and after eating, they measured the size of their gallbladder, and they actually found that about when you compared the control group to the colicky babies, they had 11% less gallbladder contraction, which means they weren't getting proper bile to break down the foods that they were eating. And that by itself can cause issues where the gallbladder and the contraction of that can cause some colicky symptoms. Typically, it's going to be more on the side of the liver, which is going to be off to your right side, right below the rib cage. So if we're having discomfort kind of in the upper abdominal area, that can definitely possibly be part due to the gallbladder, and that's something that you definitely want to talk to your doctor about. Another abnormality that they did find in some of the research was we have basically a hormone enzyme called S-motilin that is produced in the gastrointestinal system. That actually tells our intestines to move things through. And they found when we have that stimulation moving things through the digestive system, in babies that had colic, they actually had a higher amount of that. So basically things are being pushed through and they're getting more movement in their digestive tract. So if they are having gas pain, it can be very uncomfortable for them because their intestines are getting stimulated more. Interestingly enough, in that same study, they actually found that babies that had a low birth weight were 2 times higher at risk for having colic symptoms. So definitely another factor to consider when it comes to some of those gastrointestinal issues. And one other thing to think about is also gas pain. So when it comes down to gas within the intestine or gas produced by bacteria, as babies are drinking from bottles, they can be swallowing air, or if their latch is not proper while they are breastfeeding, they can also swallow a lot of air, and that can cause some discomfort for them. A lot of times parents think that they're still hungry, so they'll feed them more. And when you overfeed, you're kind of causing that same issue. You have air buildup, you're overfeeding, and that can cause more discomfort for them. Another thing that I've also seen with kiddos is in moms that were given antibiotics for group B strep, a lot of times, and this doesn't matter if they are breastfed or bottle fed, either way, when we take group B, or when we have group B strep positive and you're given antibiotics while you're in labor, that antibiotic actually wipes out and causes some bacteria imbalance in the gut for mom and baby. Usually parents can take probiotics, but kiddos typically, they may need some help with an actual over-the-counter probiotic to help rebalance those bacteria. There are not a lot out on the market that are approved for infants, so that's definitely something we want to talk to your doctor about. I know in some cases, just due to symptoms and some of the issues that we're having with colic, a lot of times I will work with parents to make sure we find the proper dosage for their kiddo and also make sure that we're getting the proper type of bacteria so it is safe for infants to take and not just kids that are older than that. So definitely another thing to consider. Second thing I want to talk about is food allergies and sensitivities. So when it comes to food allergies and sensitivities, the top 3 things that we see kids have allergies with are eggs, peanuts, and cow's milk. Matter of fact, and that is the same for, again, breastfed and also bottle babies. About 20% of the time, it has been found in research that a food allergy is usually responsible for having colic symptoms. About 25% of the time, it is due to cow's milk. And again, that may be in bottle fed as well as breastfed babies. So moms that are breastfeeding, you have IgAs that are being released in the colostrum and the breast milk that are being passed on to baby. If you have low levels of IgAs, baby may start reacting to some of the proteins in the milk that you're giving them. So if they are nursing and you are drinking cow's milk, they might start having reactions to cow's milk just because that IgA is not a high enough level to help their bodies to not react to that. On the other side, for bottle-fed babies, they can actually have IgEs that are being produced as a reaction to cow's milk because their body's not digesting that properly. So, like I said, the top 3 are cow's milk, peanuts, and eggs. So if your baby is having an issue, it's definitely a good idea to talk to your doctor about going on a lactose-free or a cow milk-free type of formula for baby to see if that works better. And then the next step would be looking into possibly eliminating peanuts or eggs from the diet, since those are the top 3 that we tend to see issues with. And then the number 3 thing that we have is our somatovisceral reflex. So that is actually the nervous system communicating with the musculoskeletal system and the autonomic nervous system. That means your brain and spinal cord communicate via nerves. They actually tell your digestive system what to do. They tell your gallbladder, your stomach what to do. And if that nerve is not working properly, that can cause a lot of discomfort. So I mentioned already, sometimes the birth process, we can have a lot of trauma to baby and their joints and their spine and their nerves. But we also need to realize that specifically when we are looking at babies that have colic, a lot of times they do have some fixation or things that aren't moving properly in their neck and upper back. Like I mentioned, a lot of times that birth process, not always the easiest on baby, especially their neck and their upper back. And when they have any fixation or nerve pressure or nerve irritation in the neck and the upper back, that can actually correspond to the nerves that go to the autonomic system that actually stimulate and help with digestion. And also in the mid-back, we have nerves specifically that go to our stomach to help us digest our food. So we may have nerve pressure going to those digestive systems that could be causing, number one, food allergies and sensitivities, things not getting broken down properly, some of those digestive issues I talked about. But another thing to think about is as well, when we're having issues in the neck and upper back, we can have muscle tension that causes discomfort in certain positions or being held a certain way. So a lot of times when baby is arching their back, when they're bringing their knees up, when they're clenching their fists, when they're crying, it may actually be because they have some muscular discomfort. So I always recommend after birth, within the first 2 weeks after birth, I recommend baby spine get checked. We want to make sure that their bones of their skull are moving properly, so we're not putting excess pressure in one area of the brain because that can cause some developmental issues. We want to make sure that blood flow and muscles are working properly so we don't have any misshapen heads. We also want to make sure that we have nerve function in the neck and the upper back working properly, so digestion's working properly, they're sleeping properly, they're not going to favor or not like to be held a certain way, or have issues during feeding where they're not swallowing properly and could be swallowing air that can cause some discomfort. I also recommend having their lower back checked because the nerves in the lower back actually correspond with intestinal function and bowel movement. So a lot of times if they're having trouble getting things through the digestive system, if they're having any pain during bowel movements, that can also cause a lot of issues. So number one, always get baby spine checked within the first 2 weeks after birth to make sure there's no issues. And if there is, there's plenty of things you could be doing. Number two, I recommend making sure that if your baby is having issues with colic, that you definitely look into egg, peanut, and cow's milk as possible allergens for you if you're breastfeeding, or in the formula if they're being bottle fed or supplemented with bottle as well. So we make sure we kind of narrow those out of the running. And then also if we're still having issues, I do recommend that you talk to your doctor more about getting their digestive system evaluated to see if there's any abnormalities like pyloric stenosis or any type of acid reflux that be causing some pain for them as well. If we're still not seeing improvements, the next step may be doing some further testing to look for other issues that are not being recognized or not tracked down. I know a lot of parents like a lot of those over-the-counter things like gripe water, which typically has fennel, as well as ginger in there to help soothe the stomach. I know a lot of people like homeopathic over-the-counter things that help, again, with soothing the gas in the digestive system. I know also there's now probiotics that are specifically for infants and older children to make sure that they have good bacteria balance. And then my tried and true, I always love to recommend this along with the chiropractic and food allergies, is also doing tummy massage. So there's an I Love You tummy massage that you can do. I will actually put a clip of that, so you can click on that at the end of this video and you can watch that I Love You tummy massage. That was back when Tori was a little tiny little baby. She was about 6 weeks old. And I go through kind of what that massage looks like and how to do it at home. You can also do that on adults, not just kiddos. And also you can also do bicycle motions with their feet where you're kind of pushing their legs up towards their chest, and the bicycle motion helps to move the muscles to help improve digestion and working gas through the intestines. So hopefully this video was educational for you. If you're a parent dealing with colic, I feel you. I had some issues. My first kiddo did have some colic symptoms in the beginning. We actually found it was due to that Group B strep antibiotic that was given in the hospital. So we were able to find a probiotic, and within a few short weeks, her colic symptoms went away, just simply by making sure we balance those gut bacteria. So definitely, I felt you, I feel you. It's frustrating. You feel alone, you feel like you're crazy, you feel like you're doing something wrong. You're not. It's just your baby is having some issues, and we need to get to the root cause of why that is, not just keep throwing things at it. We need to actually do some problem solving. So if you need some help with that, give our office a call, 309-689-6200, or check out our website, freedompeoria.org.